1 in 5 Americans will develop skin cancer in their lifetime, which is why you need to know the signs of skin cancer and how to protect yourself. Shelley Botat has more in Health Watch.
When detected early, skin cancer is highly treatable. Terry Adrian has spent much of her life in the sun.
Love it. Makes me feel good. Makes me happy.
Terry never worried about getting skin cancer.
Never really thought much about applying sunscreen.
Earlier this year, Terry believed she had a mole on her neck that was growing.
I knew it was different. It didn't belong there.
So she went to dermatologist Dr. Daniel Hertel at Aurora BayCare Medical Center wanting it removed.
I didn't think it was cancer. I just thought it was a growth.
However, Dr. Hertel suspected it could be skin cancer, so they decided to take a biopsy of the growth.
Her diagnosis was a type of skin cancer called squamous cell carcinoma in situ.
I was a little frightened.
Terry decided to have Dr. Hertel surgically remove the remainder of the skin cancer.
A lot of people enjoy the reassurance of having something removed that we can submit to the pathologist to confirm that it was all removed.
Terry is lucky her cancer was caught early. Dr. Hertel says it was likely caused by long-term sun exposure. He says ultraviolet light exposure is the most recognized risk factor for skin cancer.
Even one tanning bed use before the age of 35 can significantly increase one's risk of skin cancer. Sunburns can increase the risk of skin cancer. Tanning can increase the risk of skin cancer.
Dr. Hertel says people should self-check their moles and skin for signs of cancer.
So anything that's new, growing, bleeding, or symptomatic is something that's worth mentioning to your doctor.
Because catching skin cancer early can save your life.
It's very treatable if it's caught early, and it can be a very deadly skin cancer if it is allowed to invade and spread to other parts of the body.
The best way to reduce your risk of skin cancer is by using the right type of sunscreen and reapplying every 2 to 3 hours, or more if you're sweating or swimming.
It should be an SPF of 30 or higher, which means it's blocking 97% of the ultraviolet rays or more. It should be broad spectrum, meaning it protects against ultraviolet A and B.
Terry still enjoys soaking up the sun. However, she has changed her relationship with it by wearing more clothing outdoors, spending more time in the shade, and
My sunscreen all the time.
in addition to sunscreen, Dr. Hertel says you should avoid the sun during peak hours from 10 a.m. until around 2. Wear sun protective clothing or long sleeves, pants, and a hat. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.